Greetings, and welcome to today's program, Beyond Isolation, Returning to an Undistanced Workplace During COVID-19. This program is being recorded. I'm Daniela Baltimore, Senior Account Manager in the Corporate Learning Solutions Department at University of Maryland Global Campus, and I'm joining the program today from Alexandria, Virginia. Our program will begin shortly. This webinar is produced by UMGC. Any views expressed in this webinar are for general educational purposes only and do not represent any official views or positions of the panelist organizations. A full archive of this program will be available in the future and will send out an email once it's been posted online. We're looking forward to your great comments and questions during the program, so we invite you to shut off your cell phone, close the door, and give us your great input. When you have a comment or a question for our panel, please click on the Questions and Answers tab below the slides, type in your text, and then submit your question. You can do this at any time, so please start typing right when those ideas come to mind. Your name will be displayed on the screen along with your question or comment. Let's begin the program with a brief video from UMGC.
This is a moment that will define us. To everyone working on the front lines, University of Maryland Global Campus thanks you for your courage, keeping us safe, healthy, and learning, getting us closer to the light at the end of the tunnel. We're proud to serve you wherever and whenever you need us. University of Maryland Global Campus, more than 70 years of distance learning, from overseas to online. We are driven to serve working adults and military members who are driven to serve.
Hello and welcome. My name is Rudy Watson, Department Chair of the Business Management Department in the University of Maryland Global Campus, School of Business. As you are aware, these are indeed defining moments. The mission of University of Maryland Global Campus is improving the lives of adult learners. A part of that mission includes serving as a recognized leader in career-relevant education and sharing our perspectives and expertise. This webinar, Beyond Isolation, Returning to an Undistanced Workplace During COVID-19, is one of the many ways our institution fulfills this aspect of our mission. Our highly respected guest speakers will discuss the challenges of reintegrating employees into the workplace. After seeing the apparent success of adhering to the warnings to isolate ourselves to prevent the spread of infection, we will now be told to go back into the workplace. Most likely, we will be unsure of which of our colleagues may be carriers of the virus. This may be particularly troubling as we see the death toll most surely continuing to rise. How to handle the concerns of employees is a significant challenge. The purpose of this webinar is to present actions and propose messaging that can help in addressing the unavoidable psychological uncertainties associated with returning to work. Our panel consists of multiple subject matter experts. They are Dr. Ford Rowan, Dr. Donald Donahue, Dr. Paul Barish, and Dr. Jean LeBlanc. Dr. Ford Rowan holds a PhD in public administration. He is an advisor to the president of UMGC and a former Pentagon correspondent for NBC News. He practiced law and headed a consulting firm that advised on health and safety issues, mad cow disease, the Valdez oil spill, and explosions at chemical plants and refineries. Dr. Rowan trained public health personnel prior to the 2009 H1N1 pandemic and is co-author of Weathering the Storm, Leading Your Organization Through a Pandemic. Dr. Donald Donahue holds a PhD in health education and is a professor of healthcare administration and global health at UMGC and University of Maryland, Baltimore. He was previously senior fellow and director of health policy and preparedness at the Potomac Institute for Policy Studies, deputy surgeon, plans and fiscal administration for the Army Reserve, and department administrator and consultant for New York City Health and Hospitals Corporation. Dr. Donahue is also a member of the Board of Directors for the American Academy of Disaster Medicine and World Association for Disaster and Emergency Medicine, Vice President of the Society for Disaster Medicine and Public Health, and Editor at Large for the journal Disaster Medicine and Public Health Preparedness. Dr. Paul Barish leads the Patient Safety Commission for the World Society of Intravenous Anesthesia and is a board member of the International Academy for Design and Health, focusing on innovation and facility design, including for disasters. He has over 20 years of clinical and administrative experience in academic medical centers and integrated delivery systems. Dr. Barish has been a member of public health, disaster preparedness, team training, patient safety, quality management, and performance improvement and systems change. He has served as editor of the British medical journal, Safety and Quality, and has published more than 300 scientific papers and 5 books. His work has been cited over 10,000 times. Dr. Jean LeBlanc is a rehabilitation neuropsychologist and past Canadian representative to the American Psychological Association. She received her doctorate in clinical psychology from the University of Texas Southwestern Medical Center at Dallas, and then completed specialized training in rehabilitation neuropsychology. Dr. LeBlanc has been involved with disaster mental health since 2005, which has taken her to locations such as Haiti, New Zealand, Australia, China, the Caribbean, Central America, Canada, and the United States. Responses have included global volunteer deployments with medically focused response teams and provision of training and education to mental health professionals internationally. I will now take you through the agenda for today. First, we will have the Society of the New Normal by Dr. Rowan and Dr. Donahue, followed by The Reopened Workplace by Dr. Barish, and Crisis Leadership by Dr. Rowan, and Addressing Psychological Stress by Dr. LeBlanc. We will end with a webinar summary by Dr. Rowan. I thank each of you in advance for sharing your knowledge and expertise. At the conclusion of the presentations, we will hold a question and answer session. During the presentations, please use the chat function to submit your questions. In addition, include your name and location followed by your written question. I now welcome Dr. Warren.
Thank you, Rudy. I'm glad to talk today because the web program is to provide advice, as Rudy said, about how the transition back to work can go smoothly. Our advice is consistent with the COVID-19 program of the University System of Maryland. Don Donahue and I work for the University of Maryland Global Campus. We've reached out to our colleagues at the University of Maryland in Baltimore, at the Medical School, Graduate School, and School of Social Work, and also with colleagues at the School of Public Health at College Park, and with experts at the Bioethics Institute at Johns Hopkins University. We offer advice that is relevant, not just in Maryland, but in other states, some of which are already lifting restrictions on isolation and social distancing. Reopening is happening, and it will accelerate. It may be a rough transition. Consider 3 hotspots with lots of coronavirus cases: nursing homes, meatpacking plants, and prisons. Some employees have stopped working for fear of catching the disease and bringing it home to their families. And some are refusing to go back to work. It seems too risky. And here are our goals. We have some slides on these goals. I want to make sure that we help with the transition. Social isolation has been very difficult for some people, not just for loss of income, but for the danger of catching the disease. We've been bombarded with warnings about being with other people. We might be infected by someone who has no symptoms. Now we are being told we can transition and go back to work with lots and lots of people. Uncertainty is unsettling. Fear of the unknown threat, is still a reality. Worry about catching the coronavirus has not gone away. How will you know that the coworker next to you is not infected, and won't infect you? Experts say there may be a second wave of disease and deaths. How will organizations protect us in this environment? How do you deal with these concerns? Here's how we will help. We will describe some of the best practices for protecting health, steps to ensure a safe, productive workplace. We will discuss testing and contact tracing. We will address the psychological challenges that employees may face. We'll discuss how to communicate about risks. We want to help you prepare for the transition back to work, how you can address the anxiety of staff and visitors and customers and all manner of folks, how to deal with those who are suspicious about management's promises and priorities, how to listen to employees' concerns and suggestions, how to demonstrate a commitment to protecting health, how to show you care. Workers will perform extraordinarily if they feel their leaders have their back. Because of the importance of leadership, we've designed this presentation for people in senior management, corporations, government agencies, and not-for-profits, as well as for the frontline managers, human resources, first responders, healthcare personnel, all those folks that will be doing testing and contact tracing in the field. Training to communicate carefully will be essential. Let's start with advice on how to improve the safety, important steps that can be implemented. Here's my colleague, Don Donahue, an expert in emergency medicine who teaches in the business school at UMGC. Don.
In the 1933 film, Duck Soup, Chico Marx uttered the phrase, "Who are you going to believe, me or your own eyes?" The hook in a classic comic switcheroo, this line could easily apply to employees, customers, and the public today. In an era of instant communication, conspiracy theories, and authorities being held in low regard, simply conveying information is not enough. Research has shown that subordinate loyalty is bolstered by, among other things, believing that leadership hears and acknowledges the worker's voice. In countless professions, workers are willing to face extraordinary risk if they believe leadership is looking out for them. Consider such fields as the military, law enforcement, and the fire services. These and others are often willing to face even death based on faith in sound leadership. Sound leadership involves not only taking care of your charges, but doing so in a conspicuous manner. By this, I do not mean that you should brag about the steps being taken, but rather performing or having performed acts that clearly demonstrate to the public the considerations of leadership. A leader who asks followers to wear a mask but does not do so him or herself sends a conflicted message and creates a confused population. A couple of weeks ago, I had to take my car to the dealer for a repair. Luckily for me, auto repairs are essential in Maryland. It was certainly essential for me that morning. When I arrived at the shop, I immediately noticed that there were about 1/3 of the normal number of service advisors. The doors to the office were open, and someone was constantly wiping down the counters, door handles, seats, and other surfaces. A continuous cycle that assured customers and employees that the dealership had their safety in mind. Conspicuous cleaning sends a powerful message. Is your facility cleaned only at night or after closing? Or are there areas that can be addressed during the workday for all to see? Customer-facing activities, bank tellers and representatives, retail clerks, and some food service employees, for example, can be protected by plexiglass shields that also offer protection for the client. Some businesses are performing temperature scanning for anyone entering the building. While there is disagreement whether this is effective, It is an affirmative action that demonstrates concern. Several years ago, when some were planning for the emergency of an H5N1 influenza pandemic, an event that gratefully never occurred, the British Embassy in Washington, D.C. devised a simple but effective means of increasing hand washing. Embassy staff divided the building into sectors, the construction of the building making this designation relatively easy. At each junction between sections, a hand disinfectant station was established. Proceeding from one section to another required hand washing. At first an annoyance, the practice soon became routine. Such an approach is standard in hospitals and clinics before interacting with each and every patient, but applying it in a modified form to an office environment was an eloquently simple approach. The post-COVID-19 workplace will undoubtedly be different. Staggered arrival times, temperature checks, distributed breaks and lunch periods, all may be the norm. Open windows increase air circulation, limiting exposure to the virus. So, too, does increased circulation and room air turnover in an HVAC system. There is a pervasive sentiment in our culture against absenteeism. That is understandable, especially in positions that rely on the collaboration of others, which is likely true for most of us. Perhaps we need to instill an opposition to presenteeism, the drive to continue to work even when ill. The shortcomings of a missing coworker pale in comparison to the damage done by spreading disease and possibly death. Much remains to be learned about the SARS coronavirus 2 and its impact. Perhaps restaurant tables and workstations will need to meet new distancing standards. Telework, including telemedicine, may continue to grow. The fact is that things will probably change, but life will go on. Next, you'll hear from my colleague, Dr. Paul Varich, who will talk about the clinical aspects and the environmental aspects of this process.
Hi, thank you, Don, for that introduction. So as we think about how COVID-19 is changing the economy and the workplace, we have much to rely on from past wisdom and experience from the science of human factors, and I'd like to walk you through some of those lessons. What's clear from the science of human factors is that there's a series of very fundamental questions that are very, very relevant to these types of issues that employers are going to be asking. For example, how to protect employees, how to change policies, how to clean better, how to distance better. All these things have a deep well of wisdom that goes back at least 50 years. It needs to be relied on as we use better science to better understand how we are more capable and more coping in dealing with COVID. These are the four elements that people have been talking about, the sort of dance between the traditional measures of non-pharmacological interventions, the masks, the distancing. We've talked about the travel bans, the school closures, and of course, protecting the healthcare workers. All of these are part of a system of interventions that cannot be seen in isolation, but are tightly related to each other. And one way of thinking about the best way to deal with opening the workplace is a multi-level, multi-site intervention. That means that one workplace alone cannot change things. It has to be all workplaces. And that means that we have to be thinking about, are people willing and engaged to do so? How do we make it easy for them to do it? And we'll talk through that because this, again, is at the heart of the science of human factors. And when we talk about the carnage from COVID-19, as of today, close to 68,000 Americans have tragically died, and over 1.2 million have been infected. On the left in the slide, you can see the death rates in different countries. And on the right, you can see in the US, both deaths and excess percentage deaths in various states that have been hit the hardest, including, as you can see, in Maryland. While it's important to better understand both the measurements and the impact on the public, again, going back to the earlier thoughts that Ford alluded to, unless the public feels safe, unless they're aware, unless the data is made transparent, it's likely that they're not going to engage in the way that we would like them to do. And this is a fundamental element in the science of human factors. One of the key elements around the unknown that Don alluded to is the fact that many people who are infected don't know they're infected, and many people that could infect others don't know that they're infecting others. Here's an example looking at the 5 major cities in the US on March 1st, when the first few cases were identified in the US at the time. In fact, there were at least 28,000 cases according to certain models. So a ratio of 1 to 1,000. So if we use that ratio loosely today, we have about 1.2 million identified. It's fair to say that we might have between 10 and 50 million that have already been infected. That's based on past pandemics and earlier data from other countries around the world. And so, again, what does that mean for the workplace when people are very unsure about the numbers? It's important to go back to past experiences, and what we learned from the pandemic, the Spanish pandemic in 1918, was that it was clear that there were no solutions at the time, as there are none today, that directly target the virus. What there are solutions that are non-virus directed. Just as today we have no targeted drugs or vaccines for the virus. What did work in 1918 was social distancing and masking. Here are examples in several US cities where that was used very effectively. Sadly, this is in the past week in the US, in Orange County, in Malaysia, and Tehran. You can see how, despite distancing rules, people are not respecting those rules. And so the likelihood that this will not continue really speaks to this issue of, when we set out new rules about work, we need to talk about different ideas that relate to that. Is it work as we think it is, so-called work as imagined by politicians or by policymakers? Is it work as we think it is, as the workers? Is it work as our policies and our guidebooks? The gap between those different imagined and real work leads to more or less trust and ultimately more or less compliance. So that if we want people to actually have haircuts or be in close proximity around street stalls, we have to be aware that unless the rules can be done, they will not be followed. They will be disrespected. We've seen that around safety and quality. We've seen that around occupational hazards. And of course, we're seeing that right now when rules are made, but they're very difficult to follow, if at all. This model of human factors, it's called the social technical model. And here's an example of what it looks like. Now think about this as it applies to COVID. If we want better outcomes for the country, for people, for communities, for universities, we have to think about the processes under which they work, the physical processes, the organizational processes, and of course their actual work. So if we think about, for example, a nursing home, or if we think about a school, or if we think about a university, what is it about how people work, how they talk, what their tasks are? We actually have to better understand those characteristics, because that will dictate how often people will respect or disrespect the rules, and ultimately the success in reducing continuation of cross-infections. When we talk about masks, for example, we know very clearly that masks do help to prevent the spread if you're infected, and very likely if you're not infected, it tends to reduce the chances. But this slide shows very clearly that when the mask is adhered to well, and it's used in a way that it's supposed to be used as, then the reduction of the R naught, or the chance that you'll infect people, will go down from 2 down to about 0.5. But there's several caveats in this slide. Unless you teach people how to wear a mask, unless you teach them how to use the mask around their work, it's likely that the mask will have less effectiveness. And that's quite important. Here's an example of some work teaching people how to put a mask on. While that seems very simple and straightforward, it turns out that that can determine up to 50% of the efficacy of the mask. That equally applies to gloves, to hand sanitation. All these things are going to have to be taught to employees on a regular basis. I'm going to show you in a moment what that looks like. It's good to remember when we talk about exposure of employees, either hospital employees, doctors, nurses, administrators, or clerks in a pharmacy store or in a shopping mall, there are different levels of protection. These are protections for healthcare providers exposed to patients with COVID. What's clear here is that different levels of risk impose different levels of protection. I think we need to think about that in the same way in the workplace. Some workplaces will be in general will be seen to have very low risk and therefore will need very low level of protections. Others that have a much higher risk, there we have to think much more carefully about targeted risk prevention. I want to say a few words about the testing. There's a lot of confusion about testing. In order to open the economy, we have to be able to test and show that both people are not infected with the bug. That would be PCR tests, but equally that they have serology that shows that they have some immunity. These are the IgG and IgM, and they're very different tests. There's a lot of confusion as far as how much protection, if any, they offer, when they kick in, how long they last. For now, at least, what we are using is that we're using an IgG, which is a test that tests for how well your body is reacting to the virus. And it seems that this IgG lasts for months, perhaps longer, and perhaps like with the common flu, even if you are reinfected, the reinfection is much more mild. And again, different types of tests. I'm not going to go through that right now, but I think it's important to realize that the details of these tests will dictate their ability to successfully being used, and not just used once. You can imagine that workers will have to be tested several times over a period of time. When we talk about the variation across states, here you can see, for example, different states in the US, and clearly some states are flattening the curve completely. Other states on the right, South Dakota, North Dakota, Nebraska, Iowa, and Arkansas, there the curves are dramatically going up, primarily because there were no shelter in place in those states. And so clearly guidance for employees in those states to go back to work are going to be very different. Again, we have a great gap in the US to fill. This is how well we're comparing to other countries around the world. We're placed really at the bottom of most charts showing how many tests per population we've done. And therefore, it's going to take us much, much longer to assure that employees that go to work, customers that come to be served by those employees can feel safe about their lack of infectious ability, as well as them being secured for being infected from other people. Here are some examples of testing booths that are done around the world. In the US, we've been doing hospital testing, we've been doing some drive-ins. Here's some examples of walk-up booths that protect the healthcare workers and the testers in very clear ways. Some other examples, these are readily done in Asia, in Pakistan, in India, in many, many countries. These have been rolled out at least for about 3 weeks now, and we need to do that in the US, primarily at large employers, where they will not be able to rely on non-company testing because they won't have enough capacity. I want to say a few words about what that new workplace looks like. Here are examples from countries that have opened up. On the top, you see in China. In the middle over there, that's Kuwait, people coming to a government business. You see hairdressers in China. On the far right, you see Germany and how students are coming back to universities. On the bottom, people going to airports in Israel, churches in Korea, and finally, more examples from Korea. So these are the type of what the future might look like, and how are we going to accommodate our workplaces to address these issues. Some good highlights in this back to work. This is Taiwan. They've been able, with all the things that we've been talking about, to keep their number of deaths down to 6. And the number of infective cases about 300 in a country of 75 million people. So it is possible in a large populated Western democracy to get to these types of successful numbers, but only if our policy leaders think about how to use this data in context and understand that if we're talking about a rural county versus an urban county, if we're talking about a manufacturing plant versus a pharmacy, very, very different context that needs to be directed to how to give better guidance. So I want to wrap up with some thoughts about this program that we've talked about at the University of Maryland, this idea of creating a plan that talks explicitly about helping leaders think differently about their work, creating environmental necessities that protect employees and their managers, discussing how screening will happen, and how to mitigate against the psychological impediments that Jean will talk about later. And that means being very explicit about talking to employees and finding out what they're worried about, addressing special need populations, for example, employees that are elderly, employees that have risk factors like heart disease, lung disease, diabetes, or perhaps they've recovered from cancer and they have lifelong immune suppression. lot to be learned from the theory of learning and Deming, which is all about manufacturing quality by understanding that this is a system. We have to deal with the variation between employers, between cities, between towns and states, and we have to be focusing on change management. How do we get the employees to change their behavior? And we know that only happens if they trust the guidance they're given, if the guidance is consistent and prudent and not panic-based, and that we're able to show with transparent actions that this is the data in your company. And so, for example, this is at the Indiana University. Every day the university publishes how many people were tested, how many were infected, and this builds trust, which is based on transparency, consistency, and much more data that's given to employees and employers so they can trust the data they're getting from management. I want to end with this issue of resilient leadership that focuses on compassion, focusing on the mission of the organization, which is not just about making more money, but it's about protecting the most important asset, which are the employees, and making sure that this transparency leads to more truth-telling, more transparency, and more trust by employees. Finally, these are the types of actions that we will be talking about in this program that Don and I have been focusing on. What does staff absentee policy look like? How do we monitor the morale? How do we deal with sleeping quarters, for example, for employees that get infected? We don't want them to go home because they might infect their families. We want to deal with issues on how to help quarantine staff. When they feel better, they can do some work, perhaps not face-to-face, but maybe remote work. How do we manage the high-risk staff? And finally, how do we deal with the stigmatization against employees that have been infected? We know from examples from the US and around the world, the employees that have been infected are seen as dangerous to others, even when they're not infectious anymore, because of ignorance and fear. And so that means we have to build better evaluation of our programs so that we can show how do we design programs that are targeted to employers and teach the leaders and managers how to evaluate and implement more effectively. Finally, this lovely graphic which talks about these waves. And so we're now perhaps moving from the first wave to the second wave, but we must realize that there'll be multiple waves of this coronavirus, and that means we have to plan returning to the workforce for at least the next 1 to 2 years. And that's a different type of planning. That's not just for the next few days, but that means we have to be thinking about how do we change some of the workplaces, how do we change some of the expectations, and how do we measure employee performance differently given these changes. So, in true closing, this workplace will have to have banners around education, temperature checks, symptom trackers where employees are tracked on a regular basis, virtual environments to test them. And again, I want to focus on this issue of safe return must be about building trust where the employees and the employers feel that they can trust the data they're getting from their policy leaders, government officials, so that they believe that they will not be infected when they come back to work. Thank you.
And thank you for that fact-filled report. As mentioned, thousands of people have died from the coronavirus. There are thousands of family members who are not able to visit their loved ones in hospitals and nursing homes. Thousands who could not be present with a dying family member, a father, a mother, a wife, or a husband, or a child. The inability to be with and comfort a dying loved one can be traumatic. The funeral hasn't been scheduled. The body might be in a refrigerated truck somewhere. Grieving has been disrupted. When talking to a colleague or an employee or a customer who has lost a loved one to the virus, it's easy to slip, to inadvertently say something that triggers a traumatic memory. Triggers can hurt. There's an epidemic of suicides in this country, not a pandemic, but a high number of suicides, including suicides in law enforcement, fire, and first responders, and with veterans, high suicide rates. Knowing what to say, and very importantly, what not to say, can have a life or death impact. To learn more about these psychological factors, including psychological first aid, our next speaker is Jean LeBlanc. Jean?
All right. Thank you for having me participate in this webinar as we all confront the issues with COVID-19. And as has been mentioned, this is going to be an ongoing issue for many, if not all of us. So today I'm going to talk about the psychological stress that's common for a disaster, including a pandemic such as COVID-19. So there's key concepts to the psychology of disasters for us to keep in mind. And first and foremost is that no one is untouched by this situation. We may feel at different times that we're impacted to more or lesser an extent, but the fact of the matter is that this COVID-19 has impacted us all. Trauma includes our own individual feelings of stress and grief, but also the collective changes that we've all experienced, such as not being able to attend high school graduations, weddings, funerals, activities that we enjoy as groups. Most people do well with the stress, but we all have our good days, our bad days, and our effectiveness can change. It's important to keep in mind that PTSD is not very common in the face of disasters, but stress and grief are quite common. Many of our reactions come from our disruptions in everyday life, and if you think about it, our day-to-day world is something that most of us can do, but it's more challenging, more difficult. It requires more from us to get the same things done. And then there's the financial aspect, and there are relief packages. There are things that are sent to us and we're provided with, but that act of filling out paperwork, of seeing things through, this is also a continued aggravation of the disaster. So there's things that I would like for us to remember is that most people are resilient. Most people do not develop long-term mental health concerns. And what this inverted pyramid shows is that it's really only a small percentage, down to 3 to 4%, that develop severe PTSD, depression, and so on. So most of us will do okay. But let's look more at what the psychological impacts of a pandemic. Uncertainty is one of the largest stressors, and it's an ongoing stressor as things change, as information changes, as our knowledge base changes. Particularly for COVID-19, this is new. This is new to medical, this is new to us. So it's very hard to predict, and the information that we know about it changes quite frequently. We get mixed information about how to prevent it, how to manage it, and there's also quite a bit of a disruption to how we go about our daily lives. Some of us are separated from family and friends. Others of us have significant financial hardships. There have been there have been shortages of food and supplies, as we have seen in our stores. The loss of loved ones is significant, and loss can be both loss through death, but also through separation. And the fact of the matter is that we don't know for sure how long this will last. And it's very difficult to, in your mind, see the other side of it. So how can we lessen the impact of it? Psychological first aid is the view that most people are healthy, but if they are struggling, they could benefit from just basic support. It's not therapy, it's just a reminder of how to help people get through. You want to be sure that people are safe. And for some individuals, it can mean that you're helping them have access to masks, have access to the food that they need, the basic supplies. Psychological first aid is calming. It's just reminding people to stop, breathe, center, focus yourself. It emphasizes self-efficacy in regards to what is it that you can look at today, that you can do today. What do you have control over? Social connectedness, which is quite different for COVID-19 than it might have been for other things. Social connectedness can mean phone calls, it can mean emails, it can mean Zoom meetings, it can mean reaching out in a lot of different ways. The reminder of hope. Psychological first aid means reminding people that there is hope for a better day and that our knowledge is increasing quite a bit each day. And this will help us eventually. There is hope that we'll get to the other side of this. We can look at other countries that have moved along and we can see how they're going back and resuming routine. And this gives us a blueprint for ourselves. Also, psychological first aid is just connecting to additional resources that people may need to have information that can be helpful to them within their communities and get them going back into life or getting the resources that they need. So again, the assumption and the reminder is that most people are doing well in general, but you may all need a little bit of help to move through from one day to another from time to time. There are those of us, though, that need more specialized mental health resources. Some people have a previous history of being exposed to a lot of trauma in their past. And for these people, having another time of separation and uncertainty and trauma can mean that it can be more difficult for them. People that have substance use disorders are individuals that have poor coping to begin with. And then when you add in this long-term pandemic response, it can be extremely difficult for them as well. As you would expect, people that have a history of severe mental disorders in the past, if you experience a great deal of loss associated with the pandemic, this is also an indicator that you may benefit from more specialized response, as well as other difficulties with coping, and also being younger in age. So people that are away from family, away from other social supports, when you're younger, you haven't had as much life experience to learn ways of coping with significant events. So here are some ways to buffer the stress. I'm sure most of you have seen the many articles about self-care that are out there. Some list 5 things, some list 20, some seem like they list about 100. That unto itself can be overwhelming. But here's the basics. The basics are to pay attention to your sleep. Try to keep your sleep balanced. Try to eat healthy. Go ahead and engage and have some comfort foods from time to time. But in general, you're going to feel better if you're putting healthy food in your body. Refrain from overusing substances and minimize the constant news social media cycle, because that fuels the feelings of uncertainty and lack of predictability. Each day includes something that's enjoyable and unrelated to COVID. As I mentioned, there are lists with 20, 30, 40 things to do. I suggest you set the goal of doing just one thing a day, at least. That is something that gives you some kind of sense of relief, of something that fuels a positive feeling. The social connectedness we've talked about. Spiritual connectedness is also something that is quite important and can be quite a good buffer to stress. The work-life balance is important. A lot of us have begun working from our homes virtually. And it's very easy to feel that you need to respond to emails at all times of day, during the weekends, or being part of meetings, or Zoom conference calls, and so on. But it's very important that you have a schedule and that you limit what you do with work and that you give yourself days off. Look for meaning with what you are doing in your work and set goals for yourself each day that you can obtain. Just something simple, and focus on what it is that you can control. You can control your activities that you do with your family. You can control the activities that you do during the day. You can control the bit of work that you're doing and how well you do it. Strive to have your house be a safe, calming environment. You know, a lot of people cope by cleaning, and this is one thing that can actually help if this is something that you don't mind doing, because having a sense of calm and control can often be a benefit to you at home. Acknowledge your feelings of anxiety and grief and loss. Don't diminish them. I can't tell you the number of times I've heard people say, yes, I feel this way, but it's not as bad as. And it's very important to recognize that we're all experiencing at least a slight level of anxiety, of stress, grief and loss. We may not have lost someone directly, some of us have, but there's grief and loss of the way that we have done things in our day-to-day lives for decades. And this is a very normal feeling to have. And then be self-aware. Sometimes demands can become suddenly overwhelming in that we're doing quite well from day to day, and then you have one day that's really not a good day. This happens. It's very expected. It's very predictable. So have good communication with the people that are around you, that support you, that you work with, that you work for, and let people know that when you need a little bit of additional time, or it's one of those days where you're going to need to keep to yourself or be sure to exercise or whatever it is that you do to help you through. Other things that's very, very important is that if you find yourself unable to engage in any sort of self-care or balance in your life, get additional help to help you. And if this is particularly so if you begin thinking that suicide or harming yourself is a good idea, because it is not a good idea, and it's something that is a symptom of the stress becoming too much for you. This is the time to definitely reach out and get help, and develop a plan ahead of time. If you've ever had suicidal thoughts in the past, develop a plan of how you're going to reach out now and who you may contact and who you will contact if there is even the slightest bit of thought of harming yourself. So how might our stress be shown at home or work? Now, it varies. All of us are different. It's unreasonable to expect for everyone to respond to stress the way that we ourselves do. And you can't really use yourself as a benchmark of the right or wrong way to respond. Everyone responds differently. Some people may feel that they're less effective. They may feel that the work they're doing doesn't matter, or they're not good at it. They may have difficulty regulating their emotions. They may become quite irritable or quite sad all of a sudden. Some people may also pull back, be much less engaged with activities that they had been previously involved in, and their overall level of work output may decline. Now, keep in mind, if these are symptoms or behaviors that you show yourself, these can be flags for you that you need to go back and look at your balance and what you may be able to start adding back into your life for self-care, because something is starting to get a bit out of whack there. And these are all very common things that can happen to any of us with a prolonged stress. You may also see at work, or if you're attending school, there's increased sick time for things that aren't related to COVID-19. And there's greater absenteeism. Now, it's going to be really quite a difficult thing for us to determine in the future about what symptoms are symptoms that we need to pull ourselves out of our work and school and activities for, and what are symptoms that we move forward with and don't worry about. COVID has very vague symptoms. It has quite an array of symptoms. And so we will need to look for our medical direction to help us understand that better. The greater friction and apathy is something to pay attention for in regards to working with each other as a team at school and work. And we may very much see more arguments and more difficulties in working together. So if we take a trauma-informed perspective, the assumption is that people are really showing us the best that they can when they are returning back to work or interacting with us, and they're coping the best that they can. And so we need to recognize that people who have responded well in the past to stress, people who have coped well in the past, may not be able to always do so now. They may not have the things available to them that they used to cope in the past. And people are really doing the best that they can. So we focus on strengths and we reinforce what people are doing right. We let people know when they've done a good job with us that day, when you've enjoyed talking with them, when they've put out information or work that you've found helpful. You let people know what they are doing well. You try to avoid being overly confrontational, because the recognition is that we all are doing the best that we can. And most importantly, for those of us who work around others, is that we model the self-care that you expect for them to have. So for example, we may not respond to emails on Saturdays or Sundays. We may not do webinars on weekends. We may not do webinars at 9 p.m. at night. This is the self-care that we want to show others that are working around us. We want to emphasize the empowerment. It's very important, the best that we can, to let people make choices in their lives. Right now with COVID, there's a lot of things that we feel like that we don't have choices over. So we want to give people the opportunity to have some sort of sense of control over what they can. We want to promote safety, which we've discussed earlier in this webinar about all the different ways that we can promote physical safety. And the consistency in messaging is also something that psychologically will help us all through, as well as collaboration. We want to give people a sense that they can manage the work-related time, and if they need to take a day off, there's a way to work that, whether it's allowing people to work from home virtually, whether it's flexible days or hours. These sort of things are going to be important in the future. And we want to give consistent and meaningful supports. We want to convey the message that we are there to support people as we get through this difficult time. So in conclusion, what I would like to say about this is that COVID-19 is responsible for global change, that our feelings of stress from day to day, our feelings of one moment being really hyper involved and maybe another moment of being very disengaged, these things are normal and expected. Most people will get through these times without developing PTSD or depression, but others of us will have a bigger struggle. And it varies from person to person, a long journey for us all. And it's nothing to be ashamed about if you struggle at a greater time more than others. Most people will benefit from basic help of just a reminder to have hope, to breathe, to balance your life, to move forward the best that you can. But it's the stress when we return back to work, back to school, to expect that that may increase because it'll be another unknown, the return back. This will be another time of trying to establish where we are and how we go about doing things. And organizations can really help us through by being consistent, paying attention to how people are doing, being flexible, understanding, and helping people manage their workload. Thank you very much.
And thank you very much, Jean, for that excellent discussion of the psychological risks that are involved in this. We need to address these frightening feelings because they can result in reduced productivity, increased absenteeism, maladaptive behaviors, and conflicts in the workplace. So let's look at the summary of this. The psychological issues are enormous. They're aggravated by political partisanship, complicated by scientific uncertainty, fueled by fear of the unknown. People crave assurance, but they end up getting projections. The public wants answers, and then they hear false assumptions, misinformation. It's complicated winning support for dealing with this virus. Here are some next steps to consider, especially as we talk about contact tracing, because there's some controversial things about contact tracing, figuring out who someone has been in contact with and may have infected. We need to develop a governance framework for using the new technology, understand the usefulness and limitations of the technology. Leaders have to be cognizant of the public's needs and values, and that social justice must be maintained. We need accurate risk communication, and I really want to stress this idea that for personnel doing contact tracing, they require training in risk communication. The National Academy of Sciences defined risk communication this way: an interactive process, exchange of information and opinion, the nature of risk, concerns, opinions, reactions to risk messages. In other words, it's not just about science. Anxiety is as contagious as the virus. News media coverage amplifies the risk. Social media messages stir emotions of fear. Conspiracy stories spread outrage. Contradictory political statements can spur anger. Erroneous information fuels distrust. Why do some risks seem riskier than other risks? Unfamiliar risks seem more risky than the familiar risks. Risks that I can't control seem more risky than controllable risks. Involuntary risks are much more scary than the risks I choose to make. Risks with no benefits are a lot riskier than the risks that have benefits. And risks that can seem unfair are worse than risks that are shared broadly in society. So this is really not about just science, it's about power. Who knows? Who decides? Who controls? Who benefits? And who gets to pay? So we want to empower people with information, listen to their concerns and address them, enlist their support with honest information, because victims feel powerless. Survivors often feel like victims. The goal is to turn survivors into rescuers, rescue other people, help people in need. Great advice from Aristotle long ago. The speaker must understand the listener's concerns, fears, and hopes. Calls that pathos, how they feel. Demonstrate the speaker's ethical character, ethos. And finally, utilize effective reasons, the logos. So risk communication must ring true with the public. Be true to you, the speaker, and be true, period. To resonate, it must be authentic and accurate. Accurate risk communication is crucial. Leaders must communicate honestly with stakeholders. Contact tracing personnel need to be trained to deal with emotions. Transparency is crucial. Inspire people to help each other. Training is essential. Don't wing it. An antidote to the stress that employees may face when back to work include overcoming uncertainty with meaningful engagement, overcoming pessimism by encouraging people to do things they're good at, fight feelings of powerlessness by doing productive activities, encouraging employees to collaborate. Cohesive communities are resilient communities. In summary, for the past 20 years, I've been volunteering in prisons and in reentry programs to help inmates reintegrate back into society when they're released. In one way, might seem strange, but in one way, reentry after prison can be very similar to reintegration in the workplace after a lockdown. People who are released back into society often feel adrift, and they succumb to some bad habits. Bad habits like alcohol abuse and drugs. Right now, deaths from opioid overdoses are higher than in previous months. I'm very concerned not only about the coronavirus, but about the opioid pandemic that's already killing people. It's been killing people in the last 20 years, thousands, hundreds of thousands of people. That's another reason to reintegrate people carefully into the reopening process. Train personnel to deal with them. Help them fight feelings of powerlessness by encouraging them to do productive things. Helping others and doing a good job are good for the soul. And now we go to the Q&A.
There are multiple questions on the recording, the availability of the recording. And the answer is that it will be made available. You will get a message sent to you with the link where you could obtain the video. A question was also asked about the slides, the availability. And I'm assuming it'll be a PDF version, but you will have the slides available to you. And then another associated question was, are we allowed to share slides with other coworkers who couldn't attend this webinar? I presume that we want this in the hands of as many people as possible, but I'll let any member of our panel respond to that as well.
Yes. The answer
Yes,
is yes. You're right, Rudy.
Oh,
We want as many people to know as possible.
Okay. Then I will start with the questions that are related to content. And the first question is there a life cycle for reusable cloth mask? Is the effectiveness of reusable cloth masks the same so long as they continue to be washed?
Paul, you want to address that or should I?
I'm glad to. The truth is that non-medical cloths are variably effective. And the reality is that they're a stopgap measure. They're not optimal. And so the answer probably is not a lot. And so I'd recommend that you have multiple masks and that you wash them often. Many people, I think it's a good idea, recommend putting a filter like a coffee filter or other filters. Again, these are stopgap homemade measures. As we're all getting better at this, I think there'll be more professionally made masks for home use, which I think will integrate these ideas. But the reality is that the porosity, the holes inside most cloths mean that their ability to screen out viral particles is limited. And so, as we get more specific as to how these masks are going to protect people, I think we have to be talking about the quality of homemade cloth masks. Again, it's a stopgap measure, but from a scientific perspective, the variation in what's out there is from very useful masks to masks that aren't useful at all. And so I think we have to get better at really asking what is the quality of these homemade masks and how do we make sure that they are of material that is less porous, that has a better barrier, and incorporate some mode of a filter as you would with any other mask, which has a limited time when the filter essentially drains down like a battery. And so I know that's a kind of a variable answer, but it's tricky given the wide variation of masks available to the public. And so I'd say wash often, use a filter, and try to use a material that has small holes, less porosity, which means it has a less chance of introducing the smallest particles at the level of 5 to 50 microns. Don, do you want to add to that?
No, well, just a little. Coffee filters help. One thing I found that's particularly helpful is blue shop cloths, the things they use at auto shops, blue paper towels, basically. And it's important to realize that the mask is a limited measure, as Paul said, but it's not only to protect you from the outside, but it's to protect the other people from you. It prevents you, it limits you expelling virus if you have it. So, and recommendations I've seen are not just frequently, but you should wash your mask every day. Have 2 or 3 and just rotate them so they're always fresh.
The next question is, what do you see as the biggest threats to privacy as the result of this pandemic?
You want me to take that first, Rudy? I'd be glad to, because the contact tracing is really essential. Testing is great. We need to have that, and we're not doing enough testing. And I mean testing that's real, not just fever, but also to see if people are already carrying the virus and are asymptomatic. So testing is essential, but contact tracing happens when you go out and meet the other people, find out who someone has been with, so you can go to those other people and encourage them to get tested. So it's an outreach type program. The difficulty is it's very labor intensive. It takes a lot of energy to do those kinds of things, and a lot of people out there pounding the pavement basically to find people who may have been contacted and contract the disease. So one of the things that people are discussing is ways to use smartphones and cell phones and Fitbit type equipment to monitor the movements of people. And this presents incredible privacy issues about the technology tracing people around, following people around. And it's really an important thing to think about how you would want to structure such a program to protect individuals so their privacy isn't ruined. On the other hand, how do you protect people from a dread disease? So at some point, that's got to be reconciled. There are people at really good universities all around the country that are thinking about this. At Hopkins, for example, there's a task force to work on contact tracing. And we've been thinking about it too at the University of Maryland Global Campus. How do you do these kinds of things and not intrude on people's rights, the right not to be surveilled day and night?
Rudy, I'd love to jump in there as well. The truth is that there will be encroachment on what's seen as traditional privacy. There's a trade-off. In order to contain this virus, we have to know where people are. We don't need to know their name. We don't need to know them personally, but we need to know where they are. Inevitably, that gives you a whole series of other information that would be traditionally considered a violation of privacy. Now, there are some examples around the world where, despite use of technology for contact tracing, like in Taiwan, where while they know where the person is, all the other information is not available to them or to anybody else. So if you will, the information is on a narrow bandwidth, and that requires a lot of discipline in the hands of people that have access to that data. If you will, we have to trust them. On the other hand, I say that tongue in cheek because we know that that can be a very serious thing in this day and age. On the other hand, in Korea, for example, there the citizens have been asked, are you willing, in order for us to keep you safe, to have all your information available? And 99.9% have said yes. So they essentially have given up their privacy. There, everybody gets on their phones exactly not just where they are relative to the disease, but if they're in any relationship to any other person infected within a radius of 20 feet, they immediately get a text. So obviously there are different models out there. The Israelis are also struggling with this. And the point is that we need to have a public conversation about the trade-offs. Full containment, full success means some violation of privacy, but not complete and not in permanency. And so I think there are ways of getting more information to help contain the illness while still being very explicit about what these trade-offs are. They must be time limited. For example, in Israel, every week, the public officials have to get a renewed access to this information every week. And so that means that officials are held accountable by the public in a way that trades off, okay, we'll give you access to information, but only for a time limited period. And I think it's very important to be explicit about these trade-offs, the time limits, and the potential dangers in not keeping this information tightly, carefully observed in the public domain so that people, the media are able to help us make sure that politicians don't overstep in their ability to try to keep us safe, but not abuse and trample on our rights.
Thank you. Actually, I'm going to ask the next two questions at the same time. They're different topics, they just both deal with the federal government. And the first question is it reasonable to ask our federal government employer to provide masks to those who return to work? That's one. And the other question is, I'm curious to know what you're doing to educate state and local governments as they set the pace often for businesses.
I'll answer the first part. Is it reasonable, I ask? Absolutely. Will the agency comply? That remains to be seen. Having worked in the federal government, my belief, and it's a personal opinion, is that this will be seen as a public issue. The rules apply to everybody. Therefore, everybody is responsible, to wear shoes or, appropriate attire. The availability of masks, as Paul alluded to a little while ago, is limited by the supply chain, and by the need for people who face the virus day to day, healthcare workers, EMTs. So I think it's fair to ask, but I personally wouldn't hold out a lot of hope that that's going to happen, because it becomes a public mandate, not just an employee occupational health issue. even at this point, my wife's a nurse working in a hospital, and currently they get one mask a day. And it's not even an N95 mask, it's an examination mask. So the reality of the supply system is pretty, that's why we are using cloth masks in public again. And what was the second half of that, Rudy?
It was, what are you doing to educate state and local governments as they set the pace often for businesses? And I believe Jean was going to comment as well. Were you, Jean?
No, I didn't have a direct comment about it, but what I can say from a psychological perspective of opening up businesses and such is that what we would like to promote definitely is clear, consistent messaging and communication, as well as giving forth an idea of, if this doesn't work as planned, if cases go up, what then? So people can have an idea of the direction forward, as well as any course corrections that may be coming down the pike, because this will help people's ability to listen and follow through more effectively.
Rudy, if I can add to that.
Yes, go ahead, Ford.
Let me just quickly add. The possibility exists to do training programs for people, not necessarily degree-oriented programs at this point, but the university can do that and help people to know how to communicate more effectively with people, to not do the triggers that will further cause anxiety. And that, to me, is a very important job. And it may be even for a degree program, but it's the kind of thing that is being examined and thought about at UMGC. So I just wanted to add that, because we do have a role to play in helping people understand how their communications can have an impact, both good and bad.
And I will address the latter part of that. The University System of Maryland has assembled a task force, representatives from all 12 degree granting institutions, from the regents, and they are working diligently. In fact, some of my colleagues at UMB have been taken off their job. That's their new job, specifically to work on that. Within the system, we have the privilege of having a leading medical center, a medical school, dental, all of the professional disciplines are represented there, the law school at UMB. So they're collaborating not only within the university system and between the universities. I actually believe that all university presidents meet at least once a week on this issue, but also collaborate with the state government and with county governments and local authorities. We've been in contact with the State Department of Health, talking about contact tracing and how we can support them. So, the collaboration, at least within Maryland, is ongoing. And I believe from my colleagues elsewhere in New York and California, that's being replicated everywhere.
Paul, were you going to respond?
Yeah, two thoughts. One, to your first question, it's clear to me that all federal employees deserve to get masks. And I think that will become a standard. I think it's just a matter of time. I think any employer that expects their employees to come back should and will be required to deliver them minimum PPE in order to ensure that they feel safe, as well as they can project to their customers that it's safe to go there. So I think that goes without saying. The second thing, as to the need to train up, I think, as Don said, Don and I have been in conversations about a program. We have in Train a program to train universities, to train companies, to train others. There's a huge amount of scholarship that we can build on that goes back 50 years as to all the topics that we discussed today. We know a lot about how to manage pandemics. Although we're learning a lot about this virus, there's a huge amount of wisdom that Ford alluded to and Don alluded to and Jean alluded to that can be actively taught and trained and supervised and implemented. And we need to start that immediately. It'll take time to get good at this, but we need to begin that. And I'm hopeful that this program will lead people to start looking more deeply into these questions. And how do we train the public? How do we train employers? How do we help people deal with the fear that Ford talked about, which is not just contagious, but it's like a horror movie. People seem to be escalating day to day. And the truth is, we know a lot. There's a huge amount of science here, and we need to use that science to help protect people, to help get us back to work, and to help make sure that we're able to convey an assured message of prudence and not panic, and that can only be based on science. There is no other way to go forward but with scientific principles here. And so that is, I think, our biggest challenge, Rudy.
Okay. This next question I am going to address to you first, Jean, from a psychological perspective, and then we can get the medical and health services perspective if you want to comment. And there's a presumption. If masks are determined not to be mandatory by employees returning to work, but remain necessary to enter a grocery store, how would you address making an employee feel comfortable that a mask is not necessary for his or her coworker?
Well, that's an interesting question, and I'm not sure if I know exactly how to respond to that. My own perspective on that from a psychologist is that it's important for people to feel safe, and feeling safe is an individual perspective of what you feel like you need to wear, but it's also a perspective of what those around you are wearing. And I believe at this time it's very important, if anything, to err on the side of caution and to promote wearing masks according to what the science is telling us at this point in our response to the pandemic. And that if an individual employee doesn't want to wear a mask, I think it's very important to sit down and find out their reasoning for that and how it could be addressed to help encourage them to see the benefit to all to wear a mask. But to, as much as possible, sit down and discuss with them. People usually have reasons behind their choices to say no. And many times finding out more about that can open up the conversation and help move forward.
Anyone else?
I'll comment. In many ways, that'll be an individual institutional decision. You certainly have the right. One of the debates you see going on right now, and I'm actually quoting my older son, you have the right and the freedom to do certain things, but your rights end when they infringe on someone else's rights. And there's as Paul said, there are precedent, there are examples. It's kind of apples and oranges, but if you don't want to wear a hard hat, you're not being allowed on the construction site. Period. That's a hard, fast OSHA rule, company rule. Companies will, as they reintegrate employees, will have to consider processes like that. Will it become a mandatory? Similar, if you're in a hospital, you will wear a mask. If you don't wear a mask, you go home. Whether the science and policy will drive us to that point remains to be seen. But it may just be that you have your rights, but you cannot infringe on someone else's rights and risk those around you. Estimates are as many as 20% of the general population has some sort of a complication, obesity, diabetes, transplant, chemotherapy, all sorts of things that can make you at risk. And again, it's not your right to risk somebody else's health.
Okay. Actually, we have time for 2 more questions, and there are so many good questions. The only fair thing to do would be to take them in order. So I'm going to ask the next 2 in order, and we will get the questions answered for those of you whose questions won't be answered here. So don't be concerned about that. So the next to last question is, can employers require employees to be tested for COVID-19?
It's a good question.
It's a good question.
Yeah, I think that will depend on local jurisdiction. In the United States, health is the purview of the state, and employers. Well, I alluded to, I'm married to a nurse. She's starting a new job. She's out right now getting onboarded, and one of the documents she had to sign was a permission to go through a drug screening. So employers that may become an issue. I think there's a lot of legal and policy and ethical issues around that, and to what end, to what end do you need that information? And that'll probably be argued, into the future, whether that's appropriate or not.
Okay. And the final question, I'll just read the question as opposed to parsing it. Greetings and thank you for your time in doing this. How do you balance the initial modeling for 2 million deaths in the USA just 2 months ago to actual numbers now? Do you trust any models moving forward versus actual data collection showing much lower death rates from the recent antibody studies conducted? And should models be better represented in terms of accuracy and trust?
I'll take that as well. Problem with models is they all begin with assumptions. This was a novel virus. It resembles other coronaviruses, but it's not exactly the same. So there were different models that were widely different models came up with widely different outcomes and widely different projections. But we started off not understanding the virus, not understanding a lot about it, not knowing its infective rate, how effective it is, not knowing the fatality ratio. There's also, and I'll turn this back to Paul, there's also the factor that there was an intervention. We did social distancing. To what effect did social distancing and the things we did impact the outcome? That remains to be seen, and that will be studied. As a nation, we were slow in testing. We're still slow in testing. In an ideal world, we would have done widespread testing to identify who's infected, who's not. And they're even finding out that a lot more of us had the virus than knew it. So you're dealing with unclear facts, you're dealing with assumptions, and you're trying your best to come up with sound policy and a sound framework to move forward. Paul?
Yeah, Rudy, thanks for that. I love the great quote from George Box: all models are wrong, but some are useful. Yeah. I think that we've been overwhelmed with modeling data, and people tend to forget that there's a huge amount of assumptions that go into these models, and they have to be adjusted and adjudicated based on a huge amount of variables that keep on changing. I think models are great tools to open up the conversation and to discuss preparedness. But obviously, we can only really react to data that's real. And so there's a gap between the modeling for something multiple weeks ahead versus what happens today. And I think what you're seeing is that those models are changing, number one. Number two, that the assumptions are getting tighter and tighter based on experience from other countries and across the US. The other key challenge, Rudy, is that the models are different based on different geographies. The US, we tend to forget, is not just multiple time zones, but it's dozens of microclimates, it's hundreds of types of communities and social support systems. And that will dictate quite a bit how likely you are to get infected, how likely you are to be immune, and how likely you are to be able to sustain as a community the pandemic. If we've learned something from the 1918 pandemic, we know that some communities that took it very, very seriously were able to survive unscathed. Others who were more blasé had huge amount of infection rates. And so even inside the US, there was a dramatic difference in the responses. And so I think the models are a good place to start, but we have to be much more humble when we offer models. And we need to make sure people understand they're just models, and we can constrain them and we can change those perspectives as we follow with the non-pharmacological interventions. And that would mean the containment, the sheltering, the masks, the change in workflow, the change in perspective. All these things will dramatically change the model. But we have to remember, if we do not respect those conditions, the model, the worst possible scenario, might actually come to pass. And so that we've also learned from other countries, and that is that when the models, when the curve is bent, that's great. But when you undo the stuff that you've been doing, it's possible for the curve to go back again. It's not a one directional movement. And so I think it's important to appreciate that these models are just models, but we should use them as a way to guide us, but not necessarily to be locked into those numbers.
And on the initial models, Paul, did those include social distancing or not, when the 2 million estimate?
So the original models assumed no social distancing. It assumed an unconstrained system, which is how you need to do a model. What is your baseline, worst case scenario? So the worst case scenario was that. And then there were other models that were all over the place. I mean, the most touted model in the US from the IHME from Washington State originally argued that about 60,000 would die. And that was last week, they modified it to 70, and yesterday they modified it to 150, 200,000. So, I think that doesn't mean they're not trying to be truthful. I think what it means is that the models are highly constrained by what were the conditions and the assumptions that went into them. And I don't think people really understand truly that these assumptions need to be met in order for the model to be accurate. And so as we continue to introduce elements like social distancing, those models will obviously bend. The problem, of course, is that many of these variables are highly context and culture sensitive. And that means that distancing in a factory is one thing, distancing in a mall is another, distancing in a barbershop is quite different. And so we have to be more specific. What do we mean by distancing, and how does that change our workflow? And subsequently, we might have micro models, my shop, my street, my town, my state, that could be different than the federal models. And so this gets very complicated. And again, I think we have to be very clear, what does the model apply to? And the averages that need to be extrapolated to the federal models that might be very different in your community. And so this is where the personal accountability and responsibility of each community to take ownership of this problem in their own geographical zone in order to make sure that that model applies to them in the most specific and accurate manner.
Well, thank you all. Today's program has come to an end. And so thank you again to our panelists. And I also want to thank each and every one of you for participating. If you have additional questions after the broadcast, feel free to email us at the address that's displayed on the screen in a second. And also your questions that we were not able to get to, we will ensure that those questions get answered as well. And so we want you to stay in touch with us. And as we adjourn, I want you to make two promises. The first is to continue to exhibit the behaviors that will keep you safe. And the second is to do everything within your capacity to have a fantastic day. Thank you and goodbye.